our services as fellow humans in service to each other. Honesty, like a beacon in the darkest night, guides our path. It is the bedrock upon which trust is built in our interactions with clients, colleagues, and the community. Let us pledge to be transparent, forthright, and accountable. When we speak the truth, we create an environment where authenticity thrives. But our mission extends beyond mere honesty. We are also stewards of ideas, the seeds of progress. Each suggestion, each innovative thought has the potential to transform lives. So let us actively seek out these gems, nurture them, and allow them to flourish. Our collective wisdom is our greatest asset. Lastly, let us recognize that safety is not just physical, but emotional as well. When individuals share their thoughts, fears, and hopes, they expose vulnerabilities. Our duty is to create a space where they feel safe doing so. Let us listen with empathy, without judgment, and with an unwavering commitment to protecting confidentiality when asked. In the spirit of collaboration, let us embark on this journey together, a journey fueled by honesty, enriched by ideas, and safeguarded by compassion. So I will turn this over now, and we'll begin the introductions of our panelists.
Great, I think that's my cue, is that right?
It is.
All right, great. Well, hello, everybody. My name is Janice Zahn. I am a Bellevue City Council member and a board member of the Eastside Human Services Forum. As a member of the Eastside Human Services Forum, I'm pleased to be one of the co-facilitators for this important topic, providing services to asylum seekers and refugees. We're committed to ensuring that in Bellevue and across the East Side that we're inclusive and we celebrate the richness of our culture. We recognize that immigrants and asylum seekers want to live in safe communities and have a place to thrive. When Bellevue says Bellevue welcomes the world, our diversity is our strength, we mean it by incorporating inclusion in all of our community voices while we develop and strengthen our relationships and deepen our commitment to becoming a welcoming and inviting a community where everyone belongs. That's why we're so glad that you're here today to share your knowledge and your stories. And I thought I would actually start by sharing that, you know, when I came to the States when I was 10 as an immigrant, that was in 1976, where some of my closest friends in middle school were Vietnamese refugees. And, you know, I got a real good sense for having been somebody who was part of the chain migration and sponsored by my uncle, and yet other community members fled with nothing and relocated to a new country. And so I have a lot of empathy and understanding for refugees that and the challenges that go through to come to a different country. And so when I was asked to be a co-facilitator, I said yes immediately. So now I want to introduce each of our panelists. So I will call on each of our panelists to take 2 minutes, introduce yourself, and tell the audience about your role in providing services to refugees and asylum seekers. And first, we're going to start with Pastor Jan Bolerjack, Riverton United Methodist Church. Welcome.
Hi, thank you. It's good to be here. I'm actually on the East Coast, so it's almost bedtime here, but imagining that you are sitting in the luxury of your afternoon. I am the pastor of the church in Tukwila, the Riverton Park United Methodist Church. I've been there for 16 out of my 30 years of ministry. And just in the last year and a half, been lucky enough to welcome more than 2,000 asylum seekers, surprisingly, to my campus, and have learned a lot about what they go through, what it takes to get here, and what they need once they get here. So I'm really grateful to be able to share a little bit about that experience with you all.
Great. Well, thank you and welcome. Our next panelist is Farzana Adabaya with Afghan Advantage. I hope I did okay with your name.
Yeah. Hello, everyone. Yes, that's correct. Farzana Adabir. Thank you so much for giving this opportunity to share some things about myself and the other Afghan refugees. So my name is Farzana. My last name is Adabir. I'm working as a community outreach contractor with the Refugee Resettlement Office and also a board member with Afghan Advantage. And we are serving and helping Afghan refugees with giving having their driving permit and driving license, and also we have helping them with English teaching and English language proficiency. Thank you.
Great, thank you. Thank you and welcome. Our next panelist is Paul Lawali with Friends of Youth. Welcome, Paul.
Thank you, council members on. My name is Paul Wiley. I serve as the president and CEO of Friends of Youth. I use he, him pronouns. And Friends of Youth is an organization that's based here on the East Side that has been doing business for the last 73 years, supporting youth and young people who are in crisis. And we have a long history of working through many different federal programs, but also state programs related to settling unaccompanied refugee minors, or working with young people who have come in, whether it's through the border or different places that are still, their cases are being adjudicated or have some kind of status related to a refugee or undocumented. So that's why we're here at this panel, hoping that we can learn some more and have some good conversation. Thank you.
Great, thank you, welcome. And last panelist is Khizr Sharif with the Muslim Community Resource Center. Welcome.
Thank you, Janice. Really appreciate you and everyone else for having me on this panel. My name is Khizr Sharif. I'm the co-founder of MCRC, which Nikki, my wife, and I started about 15 plus years ago. We are the social and humanitarian program of MAPS, which is the largest mosque here in Washington State. MCRC provides a broad portfolio of interconnected services for refugees and immigrants, along with low-income and no-income families. And our services include everything from food services to transitional housing to eviction prevention, and a whole and a community free medical clinic, a legal clinic, a whole suite of interconnected humanitarian services. I also am on the board, and I serve as the CFO for another nonprofit called Essentials First, that's addressing specific hygiene equity needs amongst refugees and immigrants as low-income families. A lot of refugees and immigrants, come in and they don't have access to essential hygiene items. So we are Essentials First is trying to address that gap. I'm also serve on the board of Eastside Interfaith Social Concerns Council. And in my day job, I work as a tech executive at a local technology company. So glad to be here.
Great, well, welcome. Next, I'm going to turn this over to my co-facilitator, Linda Hellestein, to introduce herself and kick off the next part of our panel. Linda, I think you're on mute.
Unmute. I was talking to myself. Anyway, I am Linda Hillesheim from Eastside Interfaith Social Concerns Council. Our organization is one that's been around for decades, stepping in at key times and whenever there was a need brought to the attention of congregations on the East Side, as well as social concerns nonprofits. We are an organization that has a number of each of those in the organization. And from redlining to all throughout, Vietnam, support of refugees, different things that is all along the way. The faith communities and these organizations have stepped in when we hear that there's a need. We do things every month, every second Tuesday, we have a meeting and feature presenters, and they vary depending on what is most pertinent at the time, and we listen to the people that come to our meetings and try to keep abreast of everything. And lately, I'm Pastor Jan, and I don't know, Farzana, if you were at the meeting that we had in March, we were addressing these very same concerns because faith communities are some of the first ones that step up, and then people come in and branch out and connect with other organizations. So this is very important to us to be here today. Personally, my husband was from Okinawa, and I learned quite a bit from him at the time after the wars and different times. So I had a great appreciation of people coming from different countries and knowing what a privilege it is to be here as an American and to be able to help everyone that comes in and learn from them and where their needs are and let them thrive. The other thing is that we have been focusing on the lived experience, and those are important things that we want to see to keep people in the human aspect as we develop processes to assist people. So that's my little talk about Eastside Interfaith. The next step we're going to go through, and I believe this may have gone out with the registrant's packet, about the description of the differences between asylum seekers and refugees. And I'm going to just go over that. Is that correct, Elisa? So as refugees are usually outside the United States when they are screened for resettlement. They are often referred by the United Nations High Commissioner for Refugees, U.S. embassies, or certain non-governmental organizations. Refugees go through a pre-screening process at resettlement support centers around the world. They must pass an interview by a U.S. immigration officer, multiple security checks, and a medical examination. Once approved, refugees are assigned to a sponsoring resettlement agency in the United States that helps with services like housing and employment. They receive employment authorization and can request documents to travel outside the United States. They may apply for lawful permanent status, a green card, after 1 year, and U.S. citizenship after 5 years. Asylum seekers must be present in the United States or at a U.S. port of entry to apply. They seek protection based on a fear of persecution on grounds of race, religion, nationality, political opinion, or membership in a particular social group. They must prove their fear of persecution and meet requirements laid out by the UN Convention on Refugees, which the U.S. has adopted. They do not go through a third-party referral process as refugees do. These distinctions are significant under U.S. immigration law and affect the legal processes and statuses of individuals seeking safety in the United States. And I think it's really great that, going through the differences, I think that's a foggy area for a lot of people. So I'm glad that we are looking at that distinction. Now we are going to start with our first panelist question. And this question is directed towards Reverend Jan and Paul Lawali. The first question is, with the access to basic necessities, what are the most critical needs that refugees and asylum seekers face when they arrive in East King County? And how can we ensure that they have access to culturally appropriate essentials like food, clothing, and hygiene products? Pastor Jan, would you like to go first?
Sure. Thank you. It's a good question, because what we see in Tukwila is folks get off the airplane after being routed to Seattle for who knows why. Actually, they usually have my business card. Where they got that at the border is still a question. They have my business card. They have my phone number. My daughter says, change your phone number, Mom. And I say, but I can't change my address. So they walk to the church from the airport, which is about a mile, with a backpack, lugging their children, maybe pulling a car seat, maybe pulling a suitcase, and they arrive at the door and say, here we are. And we say, who are you? So our first families came from the Seattle police because they were found on the streets in Seattle, and just were not the typical families found on the streets in Seattle. So it was like, what do we do with these folks? So they started bringing them to me because they knew that Riverton Park is a place that will take those when all the other shelters are full. So we know that we already have an unhoused shelter problem. So here we've got new people coming into the county, and they start coming to Riverton, and then word gets around, and they keep coming to Riverton. So the first thing they're looking for is a welcome. They're looking for someplace that has food, that has someplace for them to sit down, decompress, relax. They've been on the road for 5, 6, 8 months, or even years. A lot of the moms that come to us are pregnant. They've walked this whole journey carrying their kids. I can't imagine how hard it must have been. And then to end up in a city where all they have is an address for a church, and the pastor at that church speaks English, nothing else. And they walk up and say, "Here we are. Can you get us a place to live?" And I had to learn very quickly what those initial needs were for food, for just a place to relax, getting them hooked up with medical services. We have a giant food bank, so we were already equipped in that way. But a lot of the other stuff I didn't know. I mean, we're right down the road from the ICE office, so that's pretty easy. They can access that pretty easy. And they do that the first day. And then they access DSHS to get their food stamps, and TANF if they can qualify, and all the other little wraparound services. Like they get an ORCA card, and it's usually loaded with $15, right, Paul? And that goes very, very fast. And how can they ever get it reloaded? So a lot of those things are just what they see first off, and they don't know the city. They don't know how to get around. They don't know the buses. They don't know the street names. And so it's very disorienting for them. And sometimes the first essential thing is to just say, all right, you can stay here. We're going to find a place for you. Just relax and we'll make it work. I don't know, Paul, what else do you see?
Yeah, no, thank you very much. I think you covered everything, so I don't need to speak.
Oh, yes, you do.
But I'll just say, first of all, thank you to EHSF for scheduling this and asking us to participate. And thank you, Linda. I think my answer is going to be very in line with what Linda said as far as the distinction between refugees and asylum seekers. There's many different things as far as on the legal side and what you can do. I think Pastor Jan has just shared some of the things related to refugees and what you can do. Please remember, as asylum seekers, you may not have some of the things that a refugee may have, you know, ability to get employment or get a green card, or some of these qualify for some of these assistance that are out there. So there's two distinctions. And I think just in our realm of the world, as far as the work that we do at Friends of Youth and other like providers, there is this part as that we identify as human service agencies. And some of the things related to the work we do is that everyone is coming to you. Once you've seen one person who's looking for support or services, just think of that person as just one person. So it's not a group of people, because everyone has a very unique situation. Every situation is very unique. Every situation is different. There are a lot of common threads, and there's so many things that are like. I'll just throw out this thing that, you know, one of the things I discovered just in the work that I've been doing on the East Side over years. This happened many years ago, that a small group came to me of local folks and asked me to, you know, I was at a place where I had a facility, and asked me to open my facility on New Year's Day to welcome some Syrian refugees. This was many years ago. And at the time, that was one of the days where we were closed. And so I kind of said no, and they bothered me enough that I had to say yes, let's do this. But one of the unique learnings, just as far as when I say unique situations and the differences between refugees and asylum seekers, was, so this was a group of about 100, there's 120 refugee folks from Syria. And they were on the East Side, and some of them had just showed up 2 weeks ago. Some of them had showed up 6 months ago. but they were all looking for a place so that they could get together. So they didn't know each other. They were from different places in Syria. And so they came together thanks to MAPS and some other groups, some other Muslim community groups that are here. And they asked me to do this thing and host them and say, hey, we just want to have a place that we could actually celebrate, New Year's Day. And I said, okay, fine. But the crux of what happened for that event was the learning of how it takes so many different people to come together. But mostly it was when you talk to the 120 or so folks, they were all so different and their situation was so different. Some of them were fleeing persecution. Some of them were fleeing war. Some of them had lost people. Some of them had known people that were helping them. And some of them had been in refugee camps for a while before they got here. So there's so many different situations. The only common thread that they had for most of them was they were from Syria. That was it, not even from the same place in Syria. So the beauty of the learning is that you have to mobilize community to help. But when you ask the question, which was really about what are some of the critical things that they face, it's a new language, it's a new culture, it's a new place, everything is new at the same time. Their situation may be very unique and could most of the time it's a traumatized situation. So addressing all those things really takes I would say compassion. It takes some empathy, but most of all just understanding, just putting yourself in this place of let me learn as much as I can. One of the unique things that I learned from that experience was, they kept on saying this birthday, that they were celebrating a birthday. And I thought maybe some of them all had the coincidence of having a birthday on January 1st. But a long held tradition from the State Department was if you are accepted as a refugee, but you did have your paperwork, I think this was a Vietnam thing, they just assign you the birth date 0101. Okay, and that's your birthday. So that's what your papers say. So all these 120 people were celebrating the unique birthday of January 1st, and that's kind of what we were celebrating there. So these learnings, but all these things coming together is really what is important. So working in partnership with community, working in partnership with different folks who actually just do one big thing. And I think Pastor Jan already said it, and that's what I'd say is the most important thing for me, how we look at the work. It's just welcoming the stranger. That's the biggest thing that I have learned over time, is how do we welcome the stranger? Once you welcome the stranger, you will have that opportunity to understand the unique things that they're facing. But if you welcome them, they will open up, they will talk to you, they will tell you what they're facing and what their needs are. But the first step has to be welcoming the stranger. Thank you.
I see that you have kind of connected with the critical needs that they have when they come. The second part of that question was ensuring that they have access to culturally appropriate essentials like food, clothing, and hygiene products. Do you run into issues with that? I believe, Kizra, that your group has, so many different groups have come down to help in different ways because it was such a need, at Pastor Jan's church and in different places. But are you finding that is more open? People are stepping forward in those areas, or is it still great difficulty? Any thoughts?
Are you asking us again or
Yes,
asking?
I am. I am asking you if you
okay, that. Sorry. Yes, we had to learn very quickly about fufu. Anybody ever eat fufu? It's the bread dough. Yeah, it's the bread, and it's just a dough that you pull a piece off and dip into whatever protein or vegetable source you have. And the fufu it takes a long time to make. So when we have we have about half Venezuelan and half Angolan Congo folks. And the Angolan Congo folks they fix their fufu. And their fufu takes a long time to cook down on the stove. It's a grain and water, basically. And so it cooks down on the stove and it takes forever. And the Venezuelans want to use the stove, and the Angolans and Congolese are still using the stove. So then they take their pot of fufu, and what do? They put it on the floor because they have to stir it for about 20 minutes to get it to the right consistency. And what happens when you put that hot pot on linoleum? You now have scorched floors. Our kitchen floors are now scorched, but you know what? It's okay, because they were able to get the food that they needed. And each new family that comes, I think, learns the hard way, and it shows on our floor. But they are able to get the food that they need, and the food that's most familiar to them. We tried doing some community meals and having some groups bring food in. Nah, didn't work. The Venezuelans have the food that they want, and our African families have the food they want, and it really works. Even though we're serving about 400 people a day on a 4-burner stove. Tell me how that works. And they all cook their own, and the fufu takes a long time. Paul, what have you found?
Yeah, what we found is you're going to have and develop up quickly if you really want to immerse in the work or understand the work. You're going to have to be immersed in a high level or heavy dose of cultural humility. When I say cultural humility, it is learning to be quiet, which is hard for a lot of us here. We all have perspectives and opinions that we want to share. It's learning that you are not the expert in somebody else's culture. And so being able to hold back and listen, learn, understand, just as Pastor Jan talked about, this is how they make their food, and food is a big part of any culture. And I think sometimes we're, even as the question says here, how do they access cultural appropriate essentials such as food and whatever? I think that this is the place where I said, everyone is unique. Every refugee person is unique. Pastor Jan talked about it, whether you're from sub-Saharan Africa or you're from a different part of the world. What are your staple foods? How do you prepare those foods? What does it take to even prepare those foods? I think we're always in the rush to prescribe, oh, here's food, I went and got a salad, or I went and got something that we can easily share, just to find out that, people would probably be polite and taste your salad, but they're not going to eat your salad. I think there's better synergies and better outcomes when you actually demonstrate the cultural humility of saying, okay, what kind of things do you typically eat or prefer to eat, or can we help you get, where they can tell you what is essential to them. But it's just again, I'll keep on saying this until I'm blue in the face, is it's welcoming the stranger, but understanding that there is the Maslow's hierarchy of needs is the same everywhere. It doesn't change. It's just the conversation that you're having and understanding the awareness of understanding that there's a unique situation going on with each person that you meet. And especially just there's so many people coming from so many different things. Please remember, when refugees come here, there's also an assumption that, they came as families. We deal primarily with young people, a lot of them unaccompanied. So you're talking about young people under the age of 18 who have left their families, may have not seen their families for years or even decades, and that's not unusual. So there's so much going on there, and I think the cultural humility is really the first step in after you welcome the stranger, is demonstrating the culture of humility. And I think some of these things, as far as the essentials, will have a way. Last, I'll just say is you're going to have to use your networks. I see some of the people who signed up here, some of the people I know, Africans though, the Eastside and some of those folks. You have to use your networks and contact them and say, hey, I have this situation of somebody from this place. What can you help me with? And usually, your networks will support you. But I'd say that's how I'd answer that question.
Thank you, Paul. And if we have a moment, if our Kizzer has his hand up.
Yeah, I just wanted to make 2 comments, right? The first one, I really understand, what Pastor Jan and Paul is talking about, socially and culturally appropriate food. So, we at MCRC get a lot of these requests when we had Afghan refugees, coming in. They wanted very specific types of culturally appropriate food, and especially if they're coming from a Muslim environment, halal is a big concern. So having access to that, and like Paul said, knowing where to reach out, who to reach out to kind of like provide those socially and culturally appropriate type food items is really important. And we at MCRC have been providing a lot of that, along with Essentials First, access to ethnic food stores, halal meat and everything else to make that assimilation easier. Number one. The second point I wanted to make was around hygiene essentials. That's something that's overlooked. A lot of times refugees show up, women don't have feminine hygiene items, soap, detergent, laundry. I mean, some very basic things, toothbrush, toothpaste, things that many of us take for granted. They don't have access to that. And even if you have an EBT card, I don't know how many of you know that EBT does not allow you to go to a store and buy shampoo and soap and feminine hygiene and any one of those products, right? So that's a huge gap in humanitarian services. That, again, knowing who to reach out to, organizations that can help, like, for example, like Essentials First can provide, that is going to be critical. So we need to be working as a coalition to help address some of these gaps and address the needs of newcomers into our communities. So that's the two comments I wanted to make.
Thank you, Kizzer. I'm just going to throw in two little things. We work a lot with Nourishing Networks, which covers the whole Eastside cities. And they are a great group that does address a lot of these concerns and gets food moving fast in different areas, along with other products. And then Renewal Food Bank, I do know that they, especially, during COVID and other times, they were doing groceries for ethnic variety. And they are also now looking at, they have one of their staff who teaches cooking at PCC, who is looking at taking the foods that are donated, because a lot of them aren't, the types of foods that people are used to, and developing recipes for that. So, I mean, we can be creative in different ways as well. I better get to the second question. It's on housing and shelter. This is Pastor Janet and Paul again. What additional strategies or policies could be implemented to provide safe and dignified shelter for those seeking refuge? And how can we address the overcrowding issue and create more suitable housing options?
Well, I think one of the big challenges is that our asylum seekers don't come with any support. So they don't come with a group that's already rallying around them to get them someplace to live. And they don't come with any financial support. Plus, they've got to work through a whole process to get a work permit. So a work permit may be at least 6 months, maybe closer to a year out before they can be self-supporting. So some folks are working under the table and are able to make their way. But as you know, our housing market is very expensive and very limited. So we have mostly had to put people in hotels, which is really expensive. And so I have one monthly hotel bill for 30 families, which is $100,000. And that's supported by community dollars that have just been so generous to keep that going. And then the other 300 folks that are under my care right now are living either in the church building or in a big tent that we've set up outside. We've taken down all of the little tents except 2, because those little tents were just not adequate housing for the folks. So housing is just really difficult. And even with the new money that King County just rolled out, that we got a big portion of, it's still probably only going to house maybe 30 couples or 30 small families for 6 months. And that's a lot of money for that little bit. And so we've got to come up with more host homes, more other supported housing until these folks can get some income. Paul, what do you think?
Couldn't agree more with you. We're Friends of Youth. We do a lot of homeless work. We do foster care work. Housing First is a principle that has guided us for over 70 years. So it starts with housing and then goes quickly to what are all the wraparound things that you will need. I would say this, as far as strategies, the biggest and best strategy, at least that worked for us, that I would harp on and recommend to everyone is use your resources to get the highest impact for the people you're trying to serve. And when I say resources, everyone usually just goes first to the money, which is one of them. And I think Pastor Jan said, these things cost, it's a hotel, whatever. But there are other resources in as far as people. There's resources in partnerships. There's resources in connections that you may have. And what I mean by that is going back to that same community and what coalitions do you belong to. This is not work that can be done, and the complex issues cannot be solved by one group or one provider or one church, or it is something that does require the full village. But please come to the understanding in this work, at least for anyone who's out there that is wondering, what can I do? How should I do it? I'd say the biggest strategy is everyone likes to point at the system, the system. And I would say, yeah, you can point at it all you want. It's not going to change that much. But you can do certain things as far as what resources do you have. Systems are defined by the people within it. And trust me, the system was never really defined for refugees or asylum seekers. So we've been trying to put things into a system to cater, but it was never really defined for those things. So it's been roughed in. Please understand that it's been roughed in. So what can we do as people who see these things happening? I think I already said, understand the uniqueness of it. I've said, there's an empathy, compassion that is needed. And then there's a quick switch to, okay, what are the assets you have and what's the highest return we can get from these assets to impact somebody's life is really the mentality or the strategy that I would say I deploy.
Okay, thank you for those answers. We have a third question as well. If there's nothing else to add to the housing and shelter, because that is a huge issue, especially, as it's very difficult for anyone to afford housing these days. So this is quite a topic that I think we'll probably continue discussing in our organizations as well. The third question is healthcare and mental health support. What healthcare services are currently available to refugees and asylum seekers in the area? How can we improve access to culturally appropriate mental health resources, considering the trauma many refugees have experienced?
Well, I sent 100 new children to my neighborhood school, the elementary school that's adjacent to my church property. Talk about being overwhelmed by the trauma that all of these kids have gone through and how to work with that trauma. And the school that I sent them to was well versed in working with refugees and migrants. And yet they were overwhelmed. So if the school is overwhelmed with the kids, a community is going to be overwhelmed with all these families, because they do bring new elements of trauma that maybe we haven't dealt with very well. And the stories, and then when they have to do their asylum paperwork, they have to rewrite all their trauma. They have to retell that story over and over. They have to tell it to the translator so it gets written in English. It's just re-traumatizing all of these. So all the kids have access to medical care. The adults do not. And so the adults are still in the idea of they get sick enough and they go to the emergency room and then they plead their case to not have to pay, but sometimes they come away with $10,000 bills, and that's just lost on them, because what could they even do to approach that? So we haven't worked nearly enough on the mental health care aspect. I've got to admit that one just has kind of fallen through the cracks with us. Paul?
Yeah, so thank you so much, Reverend Jan, for just mentioning that, because that was my answer too. I think it begins with the trauma and recognition of that, as I said earlier, it's a new space, it's a new place, it's a new language, it's a new culture. Literally everything is new and different. So you are in this space, and sometimes you're with family, without family. And the reason why you're there, and quite frankly, for our work, is anyone who's coming to us, they're coming with this prerequisite that you have to have trauma to come to us for support. So it's the same thing that most refugee or asylum seekers are going through. The prerequisite for them to gain any support is, I have experienced this trauma, or I'm still experiencing this trauma. So compartmentalizing and say, hey, there's all these needs we're going to take care of, and not dealing with a trauma is kind of one of those things for us in this sector would be like, yeah, that doesn't work, okay? Or that's a very, very nearsighted solution. You have to deal with the trauma, and the way it all starts, again, there has to be this human connection, at least from us on the clinical side will say, there has to be this human connection with somebody who can help relate to what their situation is, or understand their situation to kind of guide the conversation to something, of value or of added impact. So that is really, I would say, the biggest thing on the mental health care side is working with people who can, there's an old saying that I love from Nelson Mandela, says, speak to a man in his in language he understands, it goes to his head. But if you speak to a man in his language, it goes to his heart. And when you're dealing with trauma and you're dealing with some of these things, you need the head, but you also need the heart. So, how do you find these people who understand the language, understand the culture, that you can actually work with towards helping, supporting, influencing different things? So you're going to have to deal with the trauma, but mental health is a big deal. And then also the realization of this cultural humility that I spoke to earlier. As for us here in the United States, we're culturalized in a way that we can talk about mental health and behavioral health for the most part. It may not be that way for a lot of cultures. So understanding that part, that people may be going through, challenges related to behavioral health, mental health, whatever, or even just general health care, but they don't put it out there. And it's again, those are just regular human needs that, the cultural humility can really help us. So please understand, I'll go back to the same things. Every situation is unique. You need to demonstrate cultural humility. And the trauma, people are here because, and they have trauma, and they're experiencing trauma, and will continue to have to deal with that trauma. So you have to address all those things. Thank you.
Can
I
I
did have-
say,
Oh,
I
go
want to
ahead.
say one more thing about housing, if that's okay.
Yeah.
So here's my little soapbox. I love the fact of how many faith organizations have reached out. They've come and visited. In fact, I talked to one today. A church from Magnolia brought 3 van loads of stuff down today, including the essentials that we need, like rice, sugar, laundry soap. They're listening, they're there, they're helping. And yet when I turn it around and I say, could you just take 5 families? Don't you have a Sunday school room that you're not using right now? My church has about 10 people in worship, and we're doing all of this. Folks will say, my church isn't big enough. We don't have enough people. That argument doesn't work with me. And the argument that the building might get hurt. Okay, that's true, but I bet you could repaint that room or put that new kitchen floor down. So that's the part that's puzzled me, is that our faith communities are so giving until it comes to taking someone in their door. And maybe your communities have already done this. So maybe I'm speaking to the choir here. But I would just challenge all the faith communities in King County to consider 5 families. If everybody took 5 families, there'd be nobody on my campus. I would be so happy because they would all be cared for.
I'm just going to mention,
soapbox.
I've been talking about that a lot just in general, because Eastside Interfaith Social Concerns Council was had sub-agencies that were the men's shelter and the women's shelter. And I know that when people donate and they have big hearts, that I say, we need to tour these places. You need to meet these people and just connect better in that way. I think that would be advantageous, to just really see one-to-one who the people are. I think that's a really good thing to do a little bit more of, and would be greatly appreciated. I was just going to ask also, and I know my time's kind of running out for my questions, but when you mentioned that people have to have their traumas and information translated, are there enough people doing that are capable of doing that? Is there a wait time for people, or does that get handled pretty quickly, or is that another issue?
That's another issue. There's not enough volunteers. It takes about 12 hours to translate one asylum document. And if we were using a trauma-informed process, it would probably take a lot longer. All we're doing right now is probably looking at grammar. But yeah, we have a large legal team of volunteers working with the folks on campus and the ones that come back to us who have been able to move off. But it's still never enough. So volunteers are always needed. Translators are always needed.
Great. Do either of you have anything else you want to add to the questions that we've posed you, or are we in a good spot to carry on?
Yeah, I think there's, I don't know if
Yeah.
there's a couple of hands up, but I don't know if they're related to anything we've
Yeah.
said.
Well, as a facilitator, I just want to say that I very much appreciate the opportunity and for Eastside Interfaith to have a position on this board, because I find it very critical, and I'm learning some, and we'll share more with our organizations as we move along, and much appreciated. Thank you for everything.
Thank you, Linda. So we're going to take a few minutes. Some of the members of the audience had some questions, and then we'll move into another segment where Councilmember Zahn will be able to talk to Kizer and Farzana. So let me just pull a couple of questions because I see some themes coming up. So Debbie Lacey asked, thank you all for this event. Please share if King County government or some other entity is coordinating a regional response. And if so, who can we contact to learn more and connect?
Oh, here's another soapbox. It was a year ago now that I started bringing this to King County, to KCRHA and to King County Dow's office, and saying, what are we doing for a welcome? How are we building a welcome center for these folks that are coming in? The answer I got month after month after month was, we're waiting for the buses to arrive. And they weren't going to do anything until the buses arrived. And I kept saying, they aren't coming by bus, they're coming by airplane. But because they were arriving 10 to 15 a day rather than 60, as they were in Chicago and New York, King County just didn't respond. And so now King County is saying, maybe we should put together a welcome center. And the state is actually doing that. So that's the idea with the state funding, is not only a welcome center, but more of a cross-regional response of both the welcome, the services, the continued assistance that's needed for this new group of neighbors that we have.
And we have another question too, from Elizabeth. And I'm sorry, Elizabeth, I know I mispronounced your last name, and Linda can correct me. Maupin. We've met in person and I always tragically mess up your last name. Apologies. So the question is, who coordinates the home program? What is needed to qualify as a host home? And is there any support, linguistic, conflict, or mental health support, or anything else for host families? And someone else asked a question, how can we create more personal connections between established community members and newcomers? So those are very similar, the host families and establishing personal connections. And then what support, if anything, is available to those families and the personal interventions and support.
The host families, because we've been doing this by the seat of our pants, we have never put a policy or a procedure manual in place. People have come in and said, why didn't you do that? And it's like, because I'm too busy trying to find a bed for these people. So at some point that needs to be done. But for now, host homes have been, mostly we do a background check. We have them show some pictures of their home. And then we have them come in and sit down with some folks and see which one they think would work best at their house. And that's what we've done. And we probably had 20 families pick folks, and I would say 75% of those worked. And some of those families are still with their host families. I know there's a much more organized way to do this. And I would think that would be something a church could pick up, or a faith community could pick up and organize and wrangle, and especially Eastside families. I think that could work.
Nice. Well, I do see we have a couple more questions flowing in, and I just wanted to let some of the folks in the audience, if you have your hand up, we're having a process of this, so please we'll save that towards the end of the conversation, if that's okay, so we can keep everything on the agenda and on schedule. We see you. We're not ignoring you. Promise. We have a little bit of time set aside at the very end, so just be patient with me as we're going through all of this. So we're going to go ahead and move on now. Councilmember Zahn, we have a few questions for the remaining panelists, and then we'll have time to wrap up and answer additional questions towards the end.
Yes, thank you. So I do have some questions. I will just add one thing, and that is that the Port of Seattle at Seatac Airport has created some welcoming centers when we had our Afghan refugees that came. I probably don't have quite enough information for this group, but I do think it's a very important question. And then the questions that I have for Zana and Tizer are related to education, language acquisition, employment, economic empowerment, and legal assistance. And I actually want to start by saying that my husband was actually recruited to help with helping refugees with learning how to drive, and realizing that you can't actually get a job without a driver's license. And so there are barriers to employment. So I actually was reflecting on that as I was looking at these questions. So the first one, maybe Farzana can start. Can you share the barriers and needs to education, training, and language access for refugees and asylum seekers?
Yeah, thank you so much, Zan, for this question. Since 2019, when I'm here, and I was working as a volunteer with one of my friends who is from here, from America, and we were doing some volunteer job and helping new arrival immigration and refugees with some housing and some other supports that we are having. And but recently we found out and we noticed that there is some more and basic needs that we have to work on that. So group of Afghan and American women came together and make something different under Afghan Advantage. And Afghan Advantage are having a very essential and basic needs like digital library, which is when you go to on our website, Afghan Advantage, you can find lots of information in 3 languages, which is Dari, Pashto, and English. And you can find many different topics. When that is really essential and informative for those who are new arrival. When someone is asking, and when someone want to know about how to find a halal food, or where they can find the halal food, or how to use the bus, so they can easily go on our website, and there is and they can find all this information. And also we can also put some videos and audio because of those who with the low literacy, those who even doesn't know Dari. So this is also helpful for those. And we have also English classes, online English classes for Afghan women, and our English classes for those especially for zero literacy. And we are really happy nowadays we can have our students that they can talk before they are not talking, even they do not know their phone number, their full names, and they cannot say. Now they are able to share all this information by their own. And also we have something different. We are helping Afghan refugees or Afghan women with getting driving permit and driving license. So we are also the partnership with Undaunted Women. So I'm the one in the charge of the driving scholarship program. Uh, those who came new, you know that there is so many needs. So they are going to have first their permit, and then after that they will apply for the scholarship. Then after approval, they will have their behind the wheel classes.
Great, thank you.
Thank you.
Kizzer, I wonder if you could expand on
Yeah.
what educational opportunities exist for refugees, children, and adults, and how can we enhance these programs?
Sure. Thank you. Thank you, Janice. So one of the biggest things that we've seen in our experiences, like first, just access to information, right? This whole navigation around all the different opportunities that are available. I think that's one of the first roadblock that we see new refugees and immigrants facing, is like they don't even know where to get started. So just providing them with access to information about local community colleges, local resources that they can go to kind of like do ESL classes, navigating the educational system. I mean, I think the first step is to provide them with the access to that information, and that access to information needs to be provided to them in the local languages, right? If you're having families from Afghanistan coming, whether it's Dari or Pashto or other languages, right? Or Spanish for other immigrants who are coming from Latin American countries, just helping them navigate through that whole system, I think it's the most important. Now, second thing would be, right, providing them just doing kind of like a basic assessment of, what their current education level is, and then helping them with identifying opportunities where they can go and get some additional vocational training, or getting a diploma in certain things. It's really, really, really important, right? And again, it goes back into the framework of providing them with assistance for just navigating all the different systems out here, especially now then if you have refugees or immigrants who are coming with children and who are coming kind of like going through the school system, just helping them navigate through the different programs that may be available as they go through middle school and high school, and helping them choose the right careers. All of that is really, really critically important. And I think one of the things that we see as barriers is just the lack of access to all of this information. I'll give you two examples, right? With MCRC, now we are putting together cultural orientation workshops for refugees and immigrants, where we help provide them with the tools to navigate the educational systems. How do you get through? What are the things you need to know to kind of like put your kids through middle school and high school, and as they keep going, what are the options? How do they choose? How do you help your children kind of like choose the right different career options? What are the different vocational opportunities that are available? Providing them with that orientation and training to all the opportunities that are available. That's one of the things that we are trying to do. The second thing is doing some kind of like an assessment when someone comes, is to do an assessment of like, what are your skills and how can we get you? Because a lot of what we've seen is a lot of refugees and immigrants and asylum people are coming in. They don't want to be dependent upon handout, right? They want to be able to stand on their own feet. So how do we empower them to kind of like get them to stand on their feet? That's one of the areas that, we need to focus on. I'll give you an example. We had a client who came in, and this person came in as a refugee. He was actually a civil engineer, right? Back in the country where he came from, but unfortunately he could not get the appropriate level job as a civil engineer because he needed to get recertified and get everything else done. So while he was working, we encouraged him and mentored him and helped him identify some classes so that he could go after work, and now he's working towards actually getting recertified as an engineer here, and hopefully he'll be able to go forward and support his family. So just to summarize, right, the biggest barriers is number one, English, ESL, that's really important. Number two, just being able to know how to navigate. They just need some guidance. People need guidance around how to navigate the available systems. And number three is, doing a lot more of the mentorship to help them, upskill and get the right level of experience needed to become more productive and becoming self-sufficient.
Oh, great. Thank you very much. Well, I have to say, as a fellow civil engineer, it made me think about, like, how do we connect so that we can actually leverage the full potential of folks that are coming, but the credential doesn't translate. I'm wondering, Farzana, could you talk about how can language barriers be overcome to facilitate integration and communication? I think you spoke a little bit about it earlier. I wonder if there's more you can share there.
Yeah, if they attended in the class, like we have some colleges, still they have wait list, and we have another ESL classes that the agencies are doing, and some like Afghan Advantage are doing. So by participating and by having this ESL class, we can help them to learn English, and we can overcome with this language barrier. Yeah.
Oh, that's great. That's great. So I'm wondering, we're in a group with a lot of local community leaders, advocates, and elected officials listening in on this panel. So I'm wondering if we pivot to legal assistance and advocacy. Could you talk about how we can support refugees in navigating the complex legal processes that we have here related to asylum claims?
So is there a question for me or for Farzana?
Yeah. Or actually anyone. I know that asylum claims are a very specific area. So.
Yeah, the legal aspect is like one of the biggest needs, I believe, that we that new refugees and immigrants need. We've encountered different situations where, they really, if someone is renting, they really don't know what their rights are as renters, what their rights are, in this country. And a lot of people are really afraid. They've been scarred by previous experiences, so they kind of like are taken advantage of. So we need to educate them a lot about their rights. I mean, we've had some families who came in as refugees, and the landlords were taking advantage of them, right? I mean, putting together, all kinds of fees that were completely, I think, bogus. So they came to us for assistance, and we had to kind of like educate them and try to connect them with some legal counsel to help them push back on things that frankly they were being taken advantage of. And a lot of times it needs to be in their own language. And again, I would say, education is the key. And again, I'm going back to the culture orientation type working sessions and trainings that we're providing newcomers. It's like, know your rights. What are your rights as renters? What are your rights as an employee? What can an employer ask you to do or not do? Just that level of education, I think is so important. Just providing them access to, perhaps connecting them to local neighborhood legal clinics, providing them with lawyers who can provide them with some pro bono consulting for their immigration issues, or with issues in workplace and discriminations that they may face. Just that's really, I think, important to provide them access and tools to help them navigate through the whole the legal system here.
That's great. Well, the last question And maybe Farzana, you could start, is what advocacy initiatives can be undertaken to protect them, their rights and address the policy gaps that we've been talking about. And I'm thinking, Alicia, at this time, maybe all the panelists could talk about this one, because we're all listening to, policy gaps and ways that we can be strong allies and advocates. So, Farzana, would you like to start?
Yes, sorry, it was Alma. So for advocacy here, we as I'm working with the refugee resettlement office, so we have legal staff, and some of our co-workers are working with some legal issues when someone have a legal issue. So yeah, I don't have too much more, but maybe if Mr. Sheriff, no.
Oh, thank you. How about Kizzer and then Paul?
Yeah, sorry, Janice, can you repeat the question? I mean, you broke up there as you were asking that question.
Oh, I said, what kind of advocacy initiatives do we need to promote to address the policy gap?
Yeah. Again, with the advocacy, I think starts with just understanding what their rights are, educating them around what their rights are, doing some more assimilation into what is allowed in this culture, what is not. A lot of our refugees are coming from from cultures where certain things may have been acceptable in their environment that may perhaps are not may not fit into this culture. So as from an advocacy perspective, just making sure that our communities understand some of the cultural perspectives, some of the religious perspectives, some of the trauma that some of these refugees and immigrants are coming with, helps with generating greater empathy and understanding of issues, I think. So from an advocacy perspective, I mean, championing for for affordable housing for new refugees and immigrants, making sure that they have access to socially and culturally appropriate care, whether it's whether it's from a food perspective as well as from from a housing perspective. That is really critical, I believe. And Paul, anything else you'd like to add?
So I think you said a lot there, which is just really true. It's again going back to this empathy, compassion, but also understanding, educating yourself as much as you can on what the issue is, why the issue is. And there is a difference, and also just recognizing there is a difference between advocacy and activism. So if your jam is more about activism, how do you activate your networks or your resources? Sometimes it's making a donation, it's supporting MRC or any group that is already doing the work. So there's so many different levels that folks can engage. But I think the first thing is just again starting with this empathy, understanding that I believe personally there is a place in that all of us should welcome the stranger who's coming to our community, because we never know where we may be the stranger, or at some point in time we were the stranger and somebody welcomed us to Greater Seattle or some other place. So it's no different. It's just a human need, and I'd say welcome the stranger, and then what should you do? What is your role in understanding the system that is broken, or the gaps in the system, and leaning where you can make a difference.
Great. Well, thank you. Alisa, do we have time for Pastor Dan to also add something here, and then we can start taking questions?
Absolutely. I think I really love the way this conversation is flowing. We do have a couple of hands up from the audience, and we do have a couple more questions, but I'd love to let you finish these thoughts, because it's really leading to a good conversation. So yes, let's take a few more minutes to follow through on this, and then we'll switch over and let the audience have some participation as well.
Could I just add a tad? I just wanted to say that listening to this conversation, Some of the things that have opened a lot of eyes in our recent meetings is this idea of including people with lived experience on boards and in different places, but it makes a huge difference when you hear from them. We are looking, and that was one of the main things that some people with lived experience says, it's not just about us, it's them. And the way to get to the end result is to include them in the picture and their voices. So I just wanted to put that in there because that, they are doing those in the shelters. They're hiring them and getting the voices in the right places. And it's quite different. And one of the things that they often say is, and I'm sure it's the same way with refugees and asylum seekers, is that one of the big things is to hear their names. They said sometimes they're out there and people do not call them by their name. They feels anonymous in the community. And like Paul was saying, everyone is saying, is like that inclusiveness and not being afraid to connect. So I just wanted to put those in.
Yeah, no, thank you. I mean, we hear that quite a bit of the nothing about us without us. And actually, I can think of many, many folks that come to our country where their names are maybe not something that Americans are used to. And so they end up even taking different names just to make life easier for others. And yet that's not honoring their own individual and humanity. So Pastor Dan, did you want to say something about the policy advocacy? And then we'll take the questions from the audience.
Actually, I don't have anything to add. So you guys said it all.
Okay. Great.
Yeah,
Okay.
there's I'd like to add one thing, and right, it's really, since there's a lot of people here from the community here, one of the things that that we've seen in our experience working with new refugees and immigrants is a lot of them are highly skilled. They have a lot of abilities and talents, right? How do we kind of like bring that out to the forefront? Is there a way we can perhaps create a registry of small businesses or employers who are willing to help them find jobs, provide them with the vocational training? That's something that we've seen in our experiences missing, right? A lot of times people come to us, I need a job. What can I do? And we have to depend upon our networks to say, hey, this person has this skill. Do you have a job? And do that. But it'd be great to, as a partnership with cities and other businesses, to be able to create a registry of employers, whether small businesses or corporations, to say, what are the jobs that are available, and allow us to help match people's talents and skills with what is available. That's one. And also, second thing would be some kind of like a small business startup help for some of these refugees and immigrants. They have great talents and they have a great entrepreneurial spirit, and we've seen successes where a small micro loan for a family helps kind of like gives them the heads up to or the little nudge to kind of like be able to stand up on their own feet, whether it's setting up a bakery or setting them, doing allowing them to do something to start their own business, putting a business plan together. So there are resources that cities and other coalition of nonprofits can provide. We can really help these new people, refugees and immigrants, to really stand up on their feet and really become self-sufficient. And I think that's something that we together can really do to help them, beyond just doing this band-aid solutions of providing them with food and rental assistance and everything else. So long-term sustainability, how can we help them to become self-sufficient and stand on their feet? That's something that we together, all of us can put our heads together and help them in different ways here.
That's great. Elisa, do you want to take the questions from the audience?
Sure, I'd love to. So we've got questions flowing in on the feed, and we've got a couple of people who've had their hand up for a little bit. So I'm going to let Adam and I assume it's Council Member Lee. I will let Adam ask a question first or contribute, and then I'll defer over to Council Member Lee. And then we can take a few of the questions that are coming in on the chat feed. If you want to take a moment, panelists, to review those as well. particularly if the question was directed at you, that would be helpful too. So we'll try to get as much of this tackled as we can. So Adam, I'm gonna go ahead and allow you to talk.
All right. Okay. Hello, team. Thank you for this great discussion and conversation. I just wanted to step in to also know that we are talking, logistic, we're talking about these people, but I think the piece that I'm seeing that we are missing is community, because most communities have been out there helping this population when it started last year and giving them what they need. We go through community and ask what they need, and then we send it out, they give it to us, we come back home, we do it as community and we take it to them. But, and also another missing piece that I'm seeing is happening is language. People, asylum seekers, we have people who are speaking Portuguese, we have people who are speaking French, but we also have a language that we don't see that much often, about 75 or 80 men from Senegal who speaks Wolof, and some of them speak Mandinka. So I think the pieces that we are missing is we just focus on certain groups, but we have to bring it all as a whole. And I'm blessed to say that with the trust and the thing they have with me, I have most of those information with me. And I go out to the Senegalese market if I speak the language and talk with them what they need. So I think that's the piece we need to address first, because we are going to get them help. Everyone will run there, get their information of what they need, but they're not coming back with the language piece that they understand to help them to succeed. So that's the piece that I'm bringing in. And I also want us to see some small communities, small organizations have been doing this work around. You can IWCC, Immigrant Women Community Center, and they have been very successful. They have donated stuff to us, and then we clean it out, and then we take it out to them. But they always tend to seem to forget those small little things that community is doing. And as for the youths and the kids that are out there that I met with, the best solution is to have a building with an address so that they are not changing school every week or every 2 weeks. If they have that permanent address to address what they need so that they can stay in the schools they are in. So that's, I'm not gonna share more, but that's what I wanted to share with you guys. We are here to help, but when we are let go and nobody wants us back there, we step back. But we know how to do this work with the mighty little things we have. We know how to do it and how to be successful at it.
Thank you, Adam.
Yes, thank you, Adam. And so for the rest of the group, this is not the end of the conversation. I did post on there, we want to share resources. We'll be hosting the conversation on our Twitter, AKA X feed. So we're hoping that everybody will find us there and that the panelists can continue to engage, and that, like, for example, Adam, if you can also engage there, it's sharing with a broader audience. We'll be posting this on the recording on our website to share with others as well. So thank you for that. And then, so it looks like I'm thinking Council Member Lee. I'm gonna release the mute there.
Oh, you can hear me?
We can hear you now. Thank you for being so patient. I know you've been waiting for this opportunity, and we're glad to hear from you. Thank you so much.
Well, yeah, I've been patiently listening for the last half an hour and listening to you very passionate individuals. And I'm sure whatever I'm going to say is probably just preaching to the choir. And however, I'm going to be speaking on a few relevant things that's been brought up that has not been said. One is to talk about housing in church. I think Pastor Jan mentioned. There's churches actually used to, or they still, I don't know what they're doing it. I think they're still doing it. They house homeless people for a short period of time, on short stays. So if they could do that, I think, if you're talking about housing some of the refugee asylum seekers, there might be an opportunity to do it. So I think each of us can talk to our church or talk to other churches. Maybe they can be persuaded to take care of some of that, short-term situation. The other one is you talk about a homestay. There are organizations like Rotary, like universities. They have these housing foreign students. Well, of course, the situation is different. They're not young people students, they're the families. But at least these people are used to it. Maybe they can be a little bit more, acceptable to do similar things because they know how the experience might be. So that's just another consideration. And there are other, like University, Bellevue College, somebody mentioned. That's where you can learn more. They have many programs for foreign students, for foreign cultures, for immigrants, for education, for language skill, for ESL. I think that might be another place to look into. But another one that's important, I want to suggest, because I appreciate what Paul was saying. He's very succinct. We can advocate all day long, but it doesn't do very much. It's action that makes a difference. We can talk about what we're going to do. However, we have to be like Pastor Jan, actually do it. Okay. So there's one project you might consider. A few things I heard is bring people together, make people feel they're welcome, make them connected. These are actions. There's Bellevue City is doing a cross-culture project. Okay, we just had an RFP that encourages community-based organizations, nonprofits that will bring people together, do events. People get to know each other. And this is the project. They have over 50 organizations responded. And so obviously there's a lot of interest, a lot of people who are maybe prepared to do something. If they're not doing something, they will not be responding. So that's another source. If you want to call City of Bellevue, talk to Cross Culture Center folks, maybe there can be some connection made for you. I was hoping also to tell you a little bit about what City of Bellevue is doing. But I think it's, again, just more talks. That doesn't get anywhere. So just go do it and end of the story. Thank you.
Thank you. Well, as I said, all of these ideas, we're going to continue the conversation. Hopefully it's action oriented. That's the goal. Agreed. From what I heard, Pastor Jan is looking for more opportunities for other churches to get engaged in the housing. So that's an excellent idea. And so I'm going to, let's see here. I wanted to make sure that we had a few minutes to address some of the other questions as they came up. I do know that Guillermo was asking for contact information for the Welcome Center. And I don't know if the panelists, if you can provide that as well in the chat feed. I'm looking here, let's see. Debbie Lacey shared some information about the work their organization is doing. Tammy is endorsing Pastor Jan. Wonderful work. We also, George Gonzalez said that they've got information about the Harborview Abuse and Trauma Center. We will share that on our feed. Sarah Jacobson has a question for Farzana. And Tammy asked, will the recording be on the website? Yes. So Farzana, are you able to answer the question? It is, what was the most helpful thing for you when you arrived as a refugee just a few years ago?
When I got my driving license. Before that, I had very hard time and difficult time. I myself came in 2019 in the US, so I know English a little bit, but beside all this, and I was pregnant, and I have a 2 years son. So my husband had his job, and I just stay home. Nothing's to do or going out. I just waiting to come for my husband to come back from his work. So after then we can go some shopping or something. So after having my driving license, so I start from everything. I got my job, and now I'm doing everything by myself, shopping, having the kids to the appointment, my appointment, and my kids. So yeah, the most things. And thank you for those who really was with me, especially during in my 1 years when please tell welcome and say nice words for those who are came new and their new arrival, for especially for their 1 year. After 1 year, they are all set and they are all good.
I love that.
Thank
Well,
you.
we are very close to wrapping up. We have a couple of minutes left. I wanted to take an opportunity. I'm going to share the link for our website in the chat feed. The Eastside Human Services Forum recently revamped our website. So the conversation, will have opportunities for the conversation to continue there. We'll have opportunities for the conversation to continue on X. And I would say just thank you to everyone who participated today, especially our panelists, our facilitators, all of the audience. It's been a beautiful session, and we're going to keep in touch. This is not the last you'll see or hear from us. And any of the questions that did not get addressed or anything, I know that Tammy had a question about NAMI, and that was addressed in the feed. But if there's anything else that comes up, just don't hesitate to reach out to me. I hope everyone has my email address. It's I will type that in the feed as well. So if you have any questions you want added or anything as a follow-up, don't hesitate to let us know. But thank you everyone for your time today.
Thank you so much.
Thank you. I'll wait for everybody to capture that if anyone wants to grab the email. But thank you, everyone.